Hi, it's Dr. Wayne Whalen with helpwhathurts.com. Most of my new patients have never been to a chiropractor before, and they're all a little apprehensive about what to expect because you don't see chiropractors on TV, so it's not like they have a great idea of what it is that we do. They know if they go see their physician for a musculoskeletal problem like neck pain or back pain or shoulders or plantar fasciitis or whatever it might be, they're likely to get pain medication, anti-inflammatory, and a muscle relaxant. But they're not too sure, how it is that we're going to approach things. So I like to use an analogy. Think of a 1967 fastback Shelby Mustang. Beautiful car, will do 160 miles an hour down the freeway, unless, of course, you drive it into a pothole and knock the front end out of alignment, in which case it might still do 140 miles an hour, but it's not going to be pretty. And if you keep driving on that car, pretty soon that tire is going to go. So you can slap a new tire on it and drive on it a while again, and pretty soon that tire is going to go again. And if you keep driving, and you can replace that tire and keep driving on it, pretty soon that tire is going to go. Now the shocks are going to go. And you can replace the tire, replace the shocks, and now you got a rattle in the engine block you never had before. So you can put fresh coat of wax on the car. You can put STP in the gas tank, and you can hang fuzzy dice from the mirrors, none of which fixes the problem, which is front end's out of alignment. And you can't really often tell if the front end's out of alignment, if it's just parked at the curb, not moving. So the way I explain to my patients is chiropractors tend to look at things from a mechanical standpoint. So if a joint's supposed to fit together like this, nice and tight, but in fact it's like this, it's probably not going to work like it's intended to work. And if the muscles that support that joint are weak or too tight, it's also not going to work like it ought to. And if the nerve that innervates that whole joint and all those muscles is irritated, then it's likely to make the muscle tighter, which is likely to make the joint tighter, which is likely to make the nerve irritated, and around you go. So as a chiropractor, I have a number of tools in my toolbox to help address those issues. One of them is manipulation, and there's lots of kinds of manipulation. The point being, if I can restore some movement to a joint that's tight or locked up and begin to get it to move again, it'll start to work like it's supposed to work. If I can get the nerve to calm down, and then I can get the muscle to relax. If I can get the muscle to relax, the joint will move more normally, which will allow the nerve to go back to working normally, which will allow the muscle to relax. So it's sort of a cascade effect. So we have a number of tools that we can use to help restore normal joint motion, stretch or exercise weak or damaged muscles, and provide different kinds of therapies to reduce pain and swelling and all kinds of things like that. So that's kind of the approach that, as a chiropractor, that's how we approach things. So I hope that's been helpful. This is Dr. Wayne Whalen with helpwhathurts.com.